Hello everyone, this is Dr. Sakamoto. Today, I'd like to talk about a case of regenerative medicine that we performed for a rotator cuff tear in the shoulder. The patient who received shoulder regenerative medicine was a woman in her 70s. About 20 years ago, she started to experience some difficulty raising her shoulder. Over time, as she neglected it, the movement gradually worsened and the pain intensified, which led her to come to our clinic. When she came to our clinic, she could only raise her arm about 90 degrees forward and about 90 degrees outward. She was particularly troubled by severe pain when trying to reach for things overhead. We first conducted an X-ray examination and an MRI. The X-ray showed no significant findings. However, if you look at this MRI, the round area, which is the rotator cuff, shows a lot of white. This indicates the damaged part of the rotator cuff. In her case, it wasn't a complete tear, but a partial tear, meaning that a part of the tendon was torn. Regarding rotator cuff tears, they can occur due to sports or injury, or they can naturally occur with age as the rotator cuff wears down. When the rotator cuff is completely torn, it becomes very difficult to raise the arm. With a partial tear, where it's not completely torn, but a part is torn, symptoms such as pain when moving or a snagging sensation when moving can be observed. The fundamental treatment in conventional healthcare involves making 3 small holes in the shoulder and inserting a small arthroscopic camera. While looking at the camera, the partially torn area is sewn with thread. Or, when the tear is large, surgery is performed to bring in muscle from another part of the body to cover the tear. Ideally, arthroscopic surgery would be performed even for these small rotator cuff tears. However, in reality, if there is almost no pain, orthopedic doctors often recommend just observing the condition and considering surgery if it worsens. In other words, with conventional treatments, when there is a slight rotator cuff tear and there is little impact on daily life and no pain, it is often left untreated. If the tear gradually enlarges and it becomes difficult to raise the arm or the pain intensifies, arthroscopic camera surgery is often performed for the rotator cuff tear. However, ideally, leaving these small tears untreated is not a good idea. Regenerative medicine can fill those small tears. It can repair the tears without surgery. Another advantage of regenerative medicine is that it can regenerate the partially torn rotator cuff with the same tendon tissue. With conventional treatments, the lost or partially torn area could only be closed with stitches or covered with other muscles. However, with regenerative medicine, the lost rotator cuff area can be regenerated with tendon tissue. In this shoulder case, we administered stem cells to the partially torn area of the rotator cuff. About a month after the administration, the shoulder movement improved, and the snagging sensation when raising the arm above 90 degrees completely disappeared. 6 months later, the shoulder had improved to the point that she could do normal movements. Here's a video showing the before and after of stem cell therapy. As you can see, even for rotator cuff tears in the shoulder, it's possible to regenerate the rotator cuff and restore it to almost normal without any surgery through stem cell regenerative medicine. Today, I introduced a real-life case where we performed stem cell therapy for a partial rotator cuff tear. Thank you for watching.